Hello, everyone, and welcome to Cornerstone Wellness Conversations. I'm your host, Rachael Espaillat, and I have my co-host here with me, Dr. James Greenfield, as we explore pressing health issues in rural communities while also offering practical insights and support to raise awareness. So, thank you all so much for joining us. And Dr. Greenfield, how are you today?
Well, I'm doing good, but I'm not doing good. I got this little throat thing today, so you'll have to bear with me. And if you need me to repeat something, I will do that. What are we talking about today? Was it fatty liver or something like that?
Yes. Yes. So,
Okay.
can you tell us what is going on, what you're noticing in the community when it comes to fatty liver?
Fatty liver disease, it's a situation that occurs basically because of our lack of exercise and our poor diets in this country. And I know it seems like how many of our topics seem to go back to that, doesn't it? And what happens with fatty liver disease? We get too much fat in our system. Our liver doesn't process it well enough, and it actually gets deposited in our liver, and this damages our liver. So, ironically, the most common reason for liver failure in our country used to be alcoholism, right?
I was going to say that.
Yep,
Okay.
the alcoholic, their livers are getting drunk. Now it's fatty liver disease. So our poor diets have now damaged our liver beyond what alcohol is damaging livers. Think about that. Put that in your mind. That's
Wow.
crazy.
Yeah. Yeah. So, how often, as far as like in your office, are you seeing people being diagnosed with it?
I would say I diagnose at least once or twice a week.
Wow.
Exactly. And that's amazing. And you think about it, how many people are out exercising? It's really not a lot anymore. How many people are eating non-processed, as we've talked in the past, high fructose free, all that kind of stuff. How many people are actually doing that? Not that many.
They're not even looking at it, right?
No. Unfortunately, that's causing a lot of problems with our livers. And what happens, the first thing that I see as a provider, I'll do a blood test and I'll see your liver enzymes are elevated. Usually I used to go like, so how much you drinking? But now that's not the question. We'll do an ultrasound and the ultrasound comes back non-alcoholic fatty liver disease. And so now at that point, we have to start addressing it. Now, the thing about fatty liver disease, we've talked about diseases in the past, how things are in your own hand, like right there. And this is one that's right there. If we lose an average of 10% of our body weight, it usually, not all the time, but usually halts the progression of the fatty liver disease. If we go to 20% of our body weight down, it usually reverses it and makes it go away,
Oh, wow.
right? So it is 100% dependent on us. And that's very, very hard because it's very hard to get people to make those changes. Now, I will say probably about half the patients that develop this disease that I deal with, when they understand that if they keep going this direction, they're going to be just like the alcoholic with the big stomach and the liver failure and all those different things going on. About half the people actually do make changes because it scares them enough. Which, I don't want people to be living scared, but the reality is that's saving their liver and saving their life. It's making their life expectancy much more. Now, we don't have any particular treatments. There are some diabetic medications that use off label, have been shown to help because they help metabolize your fats better. And, I hesitate to talk too much about those things because it's still off label and you could talk to your provider about that and you and your provider could go ahead and address those things. Or if you're one of our patients coming in here, we'll talk about it. They do help and they can help you get in the right direction. But the biggest thing is going to be ourselves. You know, When you have fatty liver disease, it will progress just like any hepatitis. You get different levels of liver failure,
Mhm.
and we just don't want to get there.
Yeah,
You
of
just
course not. So when did you notice the shift from it being liver disease caused by alcohol to people's diet and the fatty liver disease?
I would say probably in the last 5 to 10 years. I mean, before COVID, it wasn't quite as much, and after COVID, I noticed it's really picking up. And no, it's not because of the COVID virus. Don't start going that direction.
Right.
It's really not. Okay, but it could be our lifestyle changes that happen too,
Right. Yeah. That's what I would
or
say.
it could just be a coincidence. We don't know.
Yeah. Yeah. And so you said most of the solution to it is proper exercise, proper dieting. And you mentioned that a good 50-ish% of your patients are making that transition. Before you get to the testing and find out that it's fatty liver disease, are there any signs or signals that patients can watch out for or be aware of to say that this might be the problem?
Well, usually there'll be fatigue. Your weight will be getting more. Although I have had very thin people have fatty liver disease, okay, but it's usually heavier people. And those are the two biggest things because you know, very early in fatty liver disease, the liver is just starting to go bad. It's not really causing problems. I mean, well, for example, hang on, let me see. Ha, I have something here for you. Can you actually see that?
Stages of fibrosis.
Yes, there you go. So this is a liver,
Mhm.
and we have 5 stages of fibrosis in this liver. And this here on the end is normal. This here on this side is, uh-oh, I'm in trouble. I need a transplant, or I'm actually developing cancer. And in between are all the other levels. And they go from an F0 to an F5. And of course, these are 1 through 4 in the middle here. And so in most cases, by the time your liver enzymes start going, we don't have, we, this is normal. Maybe we might see little enzymes go up here. We go to the next level. This is when we're going to see more enzymes go up, and you're not going to quite feel right. You might feel more tired and more fatigued. Right? So um, that I don't know if that helps answering the questions, but that can take years to get to that level because it's a slow process.
And how long from the diagnosis to like implementation of recovery, how long does that take to get your liver back in order?
Right. Well, that goes actually pretty quick. I've seen people with enzymes 5, 6, 7 times as high, probably at that stage 2 or 3 level, and within 1 to 2 years, everything's back to normal. You can't even find evidence on the ultrasound they ever had fatty liver disease. So it can heal, and it
Wow.
does really well.
Yeah. And you said that it will also like bring your life expectancy back up.
Well, sure. If your liver fails, you're going to die. I mean, it's kind of that simple. Or if your liver fails, they have to do a transplant. And then you get a liver transplant, and you're on all the immunosuppressant drugs and all these other things. Okay. Or if it gets bad enough to turn into that stage 5, where I showed you where it's turned into cancer, in that particular case, again, you're in trouble too.
Yeah. Yeah. So I know that the primary solution is fitness, exercise, and healthy eating, right? Can't get around it.
Crazy. It always is, isn't it? It always
Yeah.
ends up being that the answer. And there are so many things in healthcare that could just be avoided if we just did that. It's just amazing how much we don't.
Yeah. So if somebody is hearing this, obviously speak to their doctor, but it's even resonating just a little bit, they can
Mhm.
simply start finding a new lifestyle, diet, exercise.
Correct. Exactly. And this goes back to how important it is to get your yearly exams minimum. Okay? It's so, so important. because can you feel fatty liver disease? Does your liver hurt? Do you wake up in the morning and go, oh, I got a liver ache? No, it doesn't hurt. Your liver does not have pain fibers because your liver is not designed to be attacked. If something were to attack your body, it's got to go through the outside first. That's where all your pain fibers are, to warn you something bad is occurring. So our body doesn't waste time making things it's not going to need. So there are no pain fibers in your liver. If you could take your liver and set it out there and stab it 100 times, you couldn't even tell. You would not feel it at all. Okay, so that's kind of strange, but that's how it works. When we have liver pain, what actually happens as our liver gets damaged, it swells just like anything in your body. Okay, and there's a capsule around the liver. The capsule goes all around this liver. And so if I take this liver here and I start expanding it and making it bigger, and there's a capsule around it like a balloon, then it pushes hard enough against that capsule that it stretches the capsule. When the capsule gets stretched, that's the pain you feel because there are stretch receptors around the liver in that capsule.
Gotcha. And I'm assuming that the average person wouldn't even be able to identify that it's my liver, right? Even if
No,
they're experiencing the pain, they're not going to
it
know
would
what
just be stomach pain.
it'll
Yeah,
feel like pain.
right.
Okay.
And the thing is, as I was saying before, we hit 1, 2, 3, 0, 1, 2, 3 in these areas right here. You're not going to feel any of this.
Right.
Over here, you're going to start having symptoms. Okay. And so we would see it on the blood tests in those very early levels, which you're not going to feel. And
Yeah.
then we can address it right away. So if you come in for your yearly physical, what do? Well, one of the blood tests we do actually checks your liver enzymes.
Yeah.
That's the reason why. And that really should be done every year now, especially with how common this is becoming in our country.
So, checking with those blood tests specifically for fatty liver disease, is that something that you have been doing more recently, or has it always been that way?
I've always been doing that, and a lot of us have always been doing it. That's part of, routine screening. It's just that a lot of people don't come into a physician unless they don't feel good,
Right.
right? And if you look at that liver, by the time you don't feel good for the liver, you're way down the road. And most of our health problems, by the time we don't feel good, I mean, even take your heart. Well, by the time we have a heart attack and we finally go in, well, gee, if we'd gone in 15, 20 years earlier and addressed those high cholesterol and those clots that were going on, then you wouldn't have had the heart attack.
Yeah.
It's all, but it has to be done early. It's early preventative maintenance, and that's what this is too. And so it's important. I mean, I really encourage people in their 20s to get there on a regular basis, starting from the age 20 up, at least once a year to your doctor. Just
Proactive.
go.
And just like a regular physical or
Yeah, exactly right.
yeah. Yeah. So we've got to be more proactive and make sure that we're being aware of what we're eating and how much we're moving, right?
Correct.
Is there anything else you'd like to add or
Make sure you're seeing your provider. Make sure you're addressing these issues. Okay. And then there are some treatments that can help, and you'll talk to your provider about it. The unfortunate thing, the off label medications that we like to use, the insurances often won't pay for because it's not indicated according to their studies, which is very frustrating as physicians. When I first started in healthcare, I could use something off label and say, hey, I'm using it to do something different, and it'd be fine. But today, the insurances have really ratcheted down on our ability to really treat a patient and do things a little bit more creative to help them, unless, of course, it fits with the actual protocols that the insurance has directly.
right? Yeah.
And that's very frustrating. But,
Yeah.
you know, sometimes they go through, but most of the time they do not.
Yeah.
Yeah.
But the more we can be proactive, the
The
more
better it is. Correct. if you know that your liver's starting to go bad and you make some changes right now, you're going to be okay.
Thank you again for your insight, and we will see you all next time on the next episode.
Take care.